We cannot be the scapegoats of the inability or unwillingness of the international community to really tackle the problems that require, of course, political engagement.
Welcome to our podcast, The Syrian Health Crisis, Comparing Human Rights and Humanitarian Perspectives, by Katie, Moe, Vrishalee, and Anais. We are students from the Geneva Graduate Institute, and this podcast is part of our course on human rights and humanitarianism through the concept. We often hear the terms human rights and humanitarian law in the media, but have you ever thought about the crossover relationship between the two? These branches of law are often used interchangeably, but they are also distinct in their approaches to international conflict. Simply defined, human rights law is a legal and normative framework with a set of rules aiming to protect the dignity and rights of human beings. It applies at all times, not only during armed conflicts. Human rights organizations investigate and report on human rights violations, making recommendations to states in order to improve their application of the human rights law. Humanitarian action, on the other hand, is an immediate response to a crisis, to alleviate suffering. The response must be politically neutral, so humanitarian organizations do not take sides to any party in a conflict, and their objective is to protect life by peaceful means. We will be using the Syrian health crisis as a case study to compare the approaches, experiences, and constraints of human rights and humanitarian organizations. Next, my colleague Moe is going to provide us some background about the Syrian conflict.
In March 2011, Syria was filled with protesters calling for a revolution, joining the regional wave of uprisings known as the Arab Spring. The Syrian opposition wanted to overthrow Bashar al-Assad, a dictator whose family had been in power for more than 40 years. Actors on all sides of the conflict have decimated Syrian infrastructure as part of their strategy, targeting hospitals and critical utilities like water and energy plants. After 11 years of brutal conflict with no end in sight, Syrians are suffering now more than ever before. 14.6 million people are still in need of humanitarian assistance. 90% of people are living under the poverty line, and 6.9 million people are internally displaced, making up the largest IDP population in the world. Against this background, humanitarian and human rights organizations have been playing vital roles to protect Syrians. To investigate the differences between these two types of organizations, we interviewed 3 different experts about their work in Syria. Johan Erikkson, media advisor for the Office of the High Commissioner for Human Rights, working on the Commission of Inquiry on Syria. Christophe Martin, head of delegation at the International Committee of the Red Cross in Syria, and Claire San-Filippo, former head of mission in Syria for Médecins Sans Frontières, Belgium. After discussing each topic, my colleague Vrishalee will present our analysis.
To begin with, we will explore the respective roles of the different organizations, starting with the Commission of Inquiry on Syria. Hello, Johan. Thank you very much for being here with us today.
Thank you for having me.
So, Johan, could you tell us what is the COI on Syria responsible for and what is its objective?
So the COI Syria has been around since March 2011, like shortly after the current conflict started, mandated by the Human Rights Council to investigate and report on human rights violations inside the territory that was the Syrian Arab Republic. Our team investigates into biannual reports to the Human Rights Council.
Next, let's hear from the ICRC. Hi, Christophe. Thank you for joining us today.
It's a pleasure being with you, and thank you for this invitation.
So, could you please describe the ICRC's work in Syria?
ICRC has been present in Syria since 1967 on a permanent base. And since 2011, we've been the single biggest ICRC operation in the world, financially speaking. Here in Syria, we run operations all over the country that really, encompass the wide range of ICRC's activities, the global spectrum from protection activities, visiting places of detention, reestablishing family links, searching for people that have gone missing because of the conflicts, We have as well a lot of work in the domain of forensics. We have a large program that we have now started in working on decontamination of unexploded ordnances. Then we have all what we call the assistance activities, so health in various domains, and we can elaborate on that one, as well in water, very much involved in water, on systems, but as well on emergency responses through water tracking, and as well what we call in ICRC terminology economic security activities, where we have as well emergency response, food, non-food relief distributions, but as well working on microeconomic initiatives, livelihood projects in view of building up the resilience of the population.
Finally, our third interviewee is Claire from MSF. Good afternoon, and thank you very much for taking the time to be with us today.
Thank you so much for having me.
Could you begin by telling us what role MSF Belgium played in Syria?
We basically, as MSF Belgium, focus our work in northwest Syria. We work with MSF France and MSF Spain, and together we support 7 hospitals. We support 12 basic healthcare centers, such as clinics and health posts, and we also support or run 11 mobile clinics. The added value of those clinics is that they go very close to the patients, as accessibility to healthcare continues to be an issue. So what we do is we provide trauma and wound care. We have maternal and child health services. We run vaccination campaigns. We also provide mental health services, which, as you can imagine, are very important after 11 years of conflict. We also provide treatment of non-communicable diseases and maternal health care.
So, from your perspective, Johan, what does the COI in Syria see as the greatest long-term health challenge?
We do address health issues every time our chair, Paulo Pinheiro, speaks to the Human Rights Council or to the General Assembly or so forth. He stresses the deteriorating health situation. There is ongoing conflict, and we sat the other day with people from one of the biggest medical NGOs in Syria who just told about how these direct attacks on health facilities continue. So there was, you might recall, this summer 2021, there was this horrendous attack on the hospital in Afrin. That was like the biggest in latest times, but it still goes on. It's under physical attack too, not only because of being overstretched and underfunded and the population being in the wind, destitute and impoverished. It is also all the risks of operating in a war zone.
And Christophe, what about the ICRC?
The problem that we are facing is that you are in a country that has what we call the cumulative impacts of 12 years of conflict. To add that, of course, you have the COVID-19 that has hit, like all countries of the world, quite massively and put an increased pressure on the health systems. And there's something that is not spoken of enough, is that you can invest as much as you want, but there is a massive today brain drain. In all domains, which require precisely doctors, nurses, and other professionals in health, but as well engineers in water. So you can build up as many structures that you want. You can support through delivering medicines and equipment, but you need the know-how to have those systems running. And this is really a problem that the country is facing at large with the new generation leaving. And we might be facing a situation where Syria, 5-10 years down the road, if the situation prevails as it is today, with no capacity, no know-how to run the systems. So this brain drain is something that is of high concern for, I would say, the international community at large. And there is, because of the economic crisis, because of the sanctions as well, there's a really incredible peak in terms of the prices of medicines, which have raised by 700% since 2019. And if you put that, considering that 85%, according to UN figures, of the population is under the poverty line, it comes to the choice of populations to make between providing food to the family or buying your medicines.
And Claire, what long-term concerns does the MSF have about the health crisis in Syria?
It's a very interesting question, but it's not an easy one because there are so many different challenges that are linked and compound other issues. We see really cross-cutting challenges. Specifically, the healthcare system has been devastated by the conflict. So now the results is that hundreds of medical facilities have been bombed. There are large numbers of medical staff who have been killed or have fled the country, which means that the number of medical staff available in country is more limited. And health facilities continue to face very often shortages of essential medicines and medical supplies. This means that the care that can be given to the people is limited, and so is the quality thereof. Another concern that we've seen lately is the issue of funding gaps. The needs continue to grow, and I think it's something that's important to highlight because it's been 11 years, and there is probably to some extent, donor fatigue. There are other conflicts around the world, and there have been also other needs in terms of health. We've, of course, the COVID pandemic. So that's very problematic, not directly for MSF because our funding is independent, but that has an impact on our activities because we have seen since 2021 some health facilities either scaling down or closing them altogether because of the lack of funding.
All three of our interviewees mentioned the cumulative effect of the war and emphasized that the need in Syria is only growing while resources remain limited. As someone working in human rights, Johan is more focused on legal violations like attacks on healthcare infrastructures. Christophe and Claire instead emphasize issues like funding gaps and brain drain that affect their work providing aid and helping stabilize life for Syrians. Also, while both Johan and Claire raised points regarding donor and empathy fatigue, Johan interestingly stated that the most recent COI report still managed to get the attention it needed.
Let's move on to the comparison between human rights and humanitarian organizations. Coming back to you, Johan. How has the September report of the COI impacted the COI's dialogue with the current Syrian government?
Yeah, I think the answer to that question is that there is no functional, meaningful dialogue between us and the Syrian government. Of course, in a formal way. There is a schedule or a calendar of letters that our commission send to them and that they receive with questions. And then, of course, the report is always sent there to them. And then the Syrian government, during the interactive dialogue in the Human Rights Council, every time we have launched a mandate report, then of course they also are among the delegates who speak. But to my knowledge, there is no fruitful exchange of information.
We wanted to ask you, are there any challenges with working with humanitarian organizations, considering the fact that they have different mandates?
No, I mean, of course, when serious human rights violations have occurred and war crimes have occurred, then we must report them in our reports. Meanwhile, a UN humanitarian agency operational inside Syria must tread so carefully just to maintain access for a convoy and their trucks. I can imagine that they can get a bit scared about us when we in our report say that this atrocity happened, it was a war crime. And then we are also identifying who did it. Meanwhile, they are sitting there with their application for a convoy to go through that checkpoint, so that is where we need to be mindful of each other.
Given the recommendations included in the September 2022 COI report, what does the COI think are the next possible steps to improve the human rights conditions in Syria?
I read through our recommendations, and most of these are not going to happen, obviously. But it is let's call it a yardstick against which violations then can be defined. What our commissioners have been advocating for a long time is, we've been calling it a mechanism, but it's like an international body that is put in place to consolidate and coordinate claims of all the missing in Syria, all those who have disappeared, in detention, in comunicado detention. So among all the bodies that work with Syria now, also in the human rights and the legal realm, there is no one who currently could take on this task. So when our commissioners went 2 weeks ago to the third committee of the General Assembly, and then when in what they call the interactive dialogue after our commissioner had given his statement and all the member states talked, then there was like really high rollers in the UN General Assembly, like important member states who just spoke up and repeated this recommendation that has been put out by the Secretary General that there should be this body. And that recommendation was based on our recommendation, so we are proud of that. It's like a vital humanitarian effort for the Syrians to establish this.
And finally, we would like to ask you, does the COI receive information from humanitarian actors?
Yeah, all the time. And our investigators, when they travel in the region, they always meet with the reps and the staffers of almost every other UN organization that operates in and around Syria. And then, of course, also the humanitarian agencies, where there is like you could call it institutionalized exchange of information. And we are the people asking, and usually they give us information. And it is so formalized. And when it comes to humanitarian data, like how many are in need and how many are in tents, then of course we rely on their data collection. There is no point for us to spend resources on duplicating that work. But then of course all information that is given to us is confidential and it is know how it's going to be used and the context under which it is reported. So yeah, of course we have to make sure that we never ever jeopardize any humanitarian access and so forth. We are kind of keen to work with each other. For instance, there is only one remaining border crossing between countries for humanitarian aid between North Syria and Turkey, Bab al-Hawa. And that is renewed every 6 months by a Security Council resolution. And then there is one member state, I guess, who always threatened to veto that resolution so that there would be no cross-border aid into Syria. So when, for instance, OHCHR, UNHCR are advocating and talking in the public domain when every 6 months when this mandate is to be voted for, just urging the member states to maintain it, then we take part. And that we know that they like it when our commissioners step up to the plate and speak in public saying that Bab al-Hawa cannot be closed because the consequences is for the population inside this so-called Idlib pocket would be devastating.
Christophe, what difficulties does the ICRC face in getting regional access to provide humanitarian aid?
We are in a country where the process to reach out, to move, to be able to go and speak and meet the communities is quite a heavy one. We have to notify to the Ministry of Foreign Affairs all our movements on a monthly base, and we have to get the green lights from the Ministry of Foreign Affairs on our movements, and this is as well coordinated with our SAC partners. There are times where we don't get the green lights. There are times where you don't have access to a certain number of populations. Today, one of our biggest stumbling blocks is precisely the Northwest. We're talking here about a population of approximately 4 million people. The ICRC aims at able to reach these people by doing cross-line operations, so from Damascus or from Aleppo, and not from Turkey, which is for the time being not possible for various reasons. We don't get the required and needed security guarantees from the different factions, stakeholders that operate in the Northwest. And as well, the other difficulty that we are facing is that the SAC in itself is not accepted in the Northwest by the Turkish government as well as its affiliates. So here we are played into geopolitics and politics very clearly. But that is a big part of the frustrations that the ICRC faces.
And does the ICRC negotiate with opposition groups? Does that jeopardize your relationship with the government?
As a standing principle, the ICRC always aims at speaking with all, stakeholders, to put a very generic term. What we do, and here I'll come back to Syria, when we do that in full transparency. We never ever reach out to an armed opposition group without the government being informed. And there we might face discussions with the government officials in a country A, B, C, or D, saying, well, they don't agree, but we have to then explain that the only intention, of reaching out to these so-called non-state armed opposition groups is on humanitarian grounds and for humanitarian principles. What we aim at is being able to receive the security guarantees and hence reach out to the populations that might be in the areas that are not controlled by the governments where we work. Most of the time it is understood, it is accepted, and it is a modus operandi that we agree upon with the governments. Here in Syria, I can't go too much in details because it's quite sensitive, but we use the same modus operandi, but we are limited, I'm going to be very honest, when it comes to reaching out to non-state armed groups. Well, in the northwest, where we do not have access by definition, it's going to be difficult. You might know that we have absolutely no presence in Turkey, which is one of the only countries in the world where the ICRC would like to be and cannot work. So that, of course, prevents us as well from reaching out to a number of non-state armed groups that are basically based in Turkey at the border, in Gaziantep and other areas. In the northwest, no presence. In the center of the country, where you have these ISG sleeper cells, as well as in the northeast, we have extremely, if not any, contacts with them, but we would like to be in contact with them, ideally. But this is a very, very tight security environment. The question we have to always ask ourselves is, we would like to meet them, but would they be willing to meet us? So it takes a lot of work, of networking, small talks at different levels, but we are limited, I must confess, in being able to reach out.
What other actors does the ICRC collaborate with? Does this present challenges for your neutrality?
Our prime partnership are going to be with the ministries. Okay, it's always through the Minister of Foreign Affairs. So we work through the Minister of Foreign Affairs, but we work with the Minister of Water and Electricity, work with the Minister of Health, because it is, of course, a way of engaging a conversation with these ministries, but as well empowering them and rendering them responsible for as well their range of activities that they should be carrying out for their own populations. The SARC, as I said, natural partner that we work with. And then, of course, we engage with a range of actors that are based in Damascus from the UN system. There are as well national NGOs with which we engage. We don't have partnership agreements as such because everything really goes through the SARC. And then we have a global modus operandi when it comes to working with human rights organizations. We share a lot. And a lot is restrained information that we do not share. And when we share, we really share on a strictly confidential base.
And Claire, how does MSF maintain the principle of neutrality?
Neutrality and impartiality is obviously key principles for MSF. So what's very important to us is that we offer assistance to people based on need. And irrespective of pretty much everything else, irrespective of race, religion, gender, political affiliation, we give priority to those in the most serious and immediate danger. We do not take sides or intervene according to the demands of government or warring parties.
And what are the challenges for the MSF in terms of getting regional access to provide medical care?
From the beginning of the conflict in 2011 until today, we have not been granted authorization to work in government-controlled areas in Syria, despite repeated requests for authorization. So as a result, our areas of intervention have always been concentrated on areas outside of government control. So this means that MSF operates in Syria where we can, but ongoing insecurity and access constraints continue until today to limit our ability to provide humanitarian assistance that matches the scale of the needs.
So even between humanitarian organizations, there are differences in the way they work and receive access. This allows the organizations to act in complementary ways. For example, the ICRC does not conduct cross-border aid and has not negotiated access to northwest Syria. MSF, on the other hand, has negotiated such access, so they provide aid in northwest Syria and use cross-border methods in their work. Humanitarian organizations prioritize impartiality and confidentiality because their work depends on receiving approvals and security guarantees from states and non-state armed groups. Human rights organizations are not concerned about the relationships with the actors as much as they are with naming and shaming violators of human rights law. They receive information confidentially from many sources, including humanitarian organizations, and use it to create their reports. Without their confidentiality, human rights reports could jeopardize the agreements that human rights organizations have created with states, as Johan mentioned.
Human rights and humanitarian organizations have similar roots, but they function with different goals and approaches. They work within a larger system of international organizations, alliances, and national objectives that support populations in crisis and find solutions to the conflicts and challenges that arise. Interviewing prominent individuals from different organizations has shown us that they also cannot function without each other. Human rights organizations rely on humanitarian organizations to provide on-the-ground information and to support the population. Humanitarian organizations need human rights organizations to act as reporters and watchdogs, speaking out about atrocities where humanitarians can't. The diverse system of local, national, and global organizations cooperates to fill gaps in both humanitarian and human rights work and protect individuals' rights and basic well-being.